Batten disease is a rare and fatal genetic disorder. It affects anywhere from 1 to 35 births per 500,000 babies born. The disease commonly begins in childhood. Batten disease is autosomal recessive, meaning both parents must carry the gene for a child to be affected. The child diagnosed with Batten disease will inherit a defective CLN gene from each parent. Siblings of affected children have a 25% chance of developing the disease and a 50% chance of being a carrier. Batten disease has several types, classified by the gene mutation and age of onset. There are currently 14 types of CNL gene mutations that cause Batten disease. There are correlated types of Batten disease with a specific gene mutation, which include congenital. The age of onset is often around 6 months to 1 year, but can also have seizures that occur before birth. Infantile. The age of onset is around 1 to 2 years. Commonly, by age 3, they are completely dependent. Late infantile. The age of onset is about 2 to 4 years old and is commonly caused by the CLN2 mutation. Juvenile is the most common type of Batten disease. The age of onset is 4 to 7 years. Adult. The age of onset is typically in their 30s, but they can develop earlier during adolescence or later in their 50s. Adult Batten disease is divided into two types, type A and type B. Batten disease is caused by a malfunction in the cellular waste management system, preventing cells from disposing of waste properly. This leads to devastating effects on the brain and nervous system. The buildup of waste within the cell is called ceroid lipofuscin. This occurs because lysosomes, the cell's recycling centers, fail to function properly. When neurons can't remove waste, they gradually deteriorate and die. This process affects key brain regions, causing neurological damage that leads to the severe symptoms commonly seen in Batten disease. The symptoms of Batten disease worsen over time. While different forms may appear at different ages, all types share common symptoms. Seizures, vision loss, eventually leading to blindness, cognitive decline, including memory loss and difficulty learning, speech and motor difficulties. Eventually, children with Batten disease lose the ability to walk, talk, and swallow, until they become fully dependent on their caregivers. Diagnosing Batten disease involves different possible types of tests. Eye exams to assess retinal and optic nerve health. Blood, urine, or saliva tests to analyze DNA for genetic mutations. Skin sampling to check for waste buildup in cells. Genetic testing which is able to provide a definitive diagnosis. Currently, there is no cure for Batten disease. However, some treatments are used to help manage symptoms. Anti-seizure medications to control seizures. Spasticity treatments to reduce muscle stiffness. Medications for anxiety and behavioral issues. Physical and occupational therapy to help maintain function for as long as possible. Enzyme replacement therapy, which is used for children with CLN2 mutations. This treatment can slow down the disease progression. CLN2 is currently the only form of Batten disease that has an FDA-approved treatment. Batten disease is a devastating condition, but research continues to advance our understanding and potential treatments. Thank you for taking the time to learn about this important topic. Together, we can support ongoing research efforts and help families affected by Batten disease.